This module talks about the effects of childbirth on the birthgiver. We will talk about her emotions, her bodily changes, and what happens to her self-esteem. Now, what happens after childbirth? You're there, the baby is there. All you need to do is breastfeed, right? No, you go through a lot of changes. Not just in your body, your emotions change, your hormones are changing, and you will go through a lot of self-esteem issues also. We're going to talk about all that in detail today, but it's a period of change and transformation that you go through after childbirth. So first we'll talk about your body. Yes, your body goes through a lot of changes after childbirth, but it also depends on the kind of childbirth experience you've had. Let's say you went through a vaginal birth. What kind of changes will your body go through? Your vagina, which was this big, would have probably expanded for the baby to come out. So yes, the body has to shrink back to its original size. And that's going to take a lot of time, which means your body is going to feel bloated for a while. Apart from that, if you have gone through a vaginal birth, there is a high possibility that you have also gone through an episiotomy stitch, which is a stitch that is done on your perineum, which is the area between the vagina and the anus, and that can hurt. Many people also go through constipation because of the stitch, which means you might be on stool softeners, you might be sitting on a pillow for a while, and you will have to breastfeed also sitting on that pillow. So first 7 to 10 days there will be intense pain. Yes, you can be on pain medication depending on what your care provider wants you to do, but please anticipate this pain after childbirth. Now the next option is, if you have gone through a cesarean section surgery, then yeah, your body has a huge stitch mark and you have to take care of that stitch. So you'll be given a lot of instruction by your care provider. You'll have to follow all that. Again, bending, lifting, such activities might be a no for a while. You'll be on complete rest. Yes, you'll be breastfeeding, but then you'll have to rest a lot so that these stitches heal without any further complications, or it shouldn't develop an infection. So you need to be very careful about these stitches. Now the healing time will differ based on, again, the kind of childbirth experience you've had. Mostly women who have gone through vaginal births heal and recover faster or sooner than someone who has gone through a C-section surgery. Now even if you have gone through a vaginal birth or a C-section birth, your stomach will be bloated, your abdomen will be big. It will not immediately shrink back or go back into its pre-pregnancy size or shape. So please don't be in a hurry to reduce your tummy or flatten your tummy or anything. There's a lot of time to do all that. We will talk about that in the upcoming topics, but please anticipate a bulging tummy after childbirth. No matter what kind of childbirth experience you've gone through, it will be big. The stomach will be big. You can also experience urinary incontinence, fecal incontinence for a while after childbirth because every organ in your body would have gone through some changes in terms of positioning. So it has to all come back to shape, and for the body to regain its activities like it used to do before, it will take some time. Nevertheless, whatever kind of childbirth experience you went through, you will have to strengthen your pelvic floor in the upcoming months. Apart from all this, let's go to another part of your body which didn't actually actively be involved in childbirth, which is your breasts. Now, considering you are a female-bodied person and you choose to breastfeed, you will go through some breastfeeding difficulties as well. The first thing you can expect is heavy, engorged, leaking breasts. So you'll have to be prepared with tissues, towels and breast pads where you can absorb the leaking milk. You'll have to be prepared with a breast pump if you want to pump and give milk to your baby. You'll need a breastfeeding pillow. Some people do very well with normal pillows also. This is why I recommend all parents, okay, not just the person who's giving birth, but including the partner, they have to go through a lactation preparation class, or it's also called a lactation management class. So they will be taught all these techniques, they will know what all they have to purchase in terms of their breastfeeding journey. Now, when you're breastfeeding, you can also expect little bit of pain in the first few days, which should actually resolve on its own. But if it's not resolving, please don't apply a cream and wait for it to get better. Please meet a lactation professional and get it sorted. Now, parents who are not able to breastfeed, there are so many reasons why you will not be able to breastfeed. Maybe you think you don't make enough milk and then you went off and gave formula right away. Sometimes what will happen from the hospital itself, they can start off the baby on formula, and many parents get into formula feeding right away. Sometimes what will happen, they would have breastfed for a while, but then because of intense pain or because of some reason, they would have transitioned to formula. So like that, so many things can happen, or maybe your care provider itself would have suggested formula for some reason. Now, whatever it is, I want parents to be mentally prepared for this, because inability to breastfeed can cause a lot of guilt and shame, and you need to be prepared for this plan B, which is formula feeding. Even if you plan to breastfeed, I think you should all be ready to accept the reality. Sometimes you will have to give formula for the baby. ஸோ குழந்தை பிறந்ததுக்கப்புறம் எல்லா மதர்ஸ்க்கும் தோன்ற ஒரு விஷயம் என்னென்னா, ஐயோ நம்மளை பார்க்குறதுக்கு நல்லா இல்லையே, நம்மளுக்கு பெரிய தொப்பை வந்துருச்சே, அதே மாதிரி வயிற்றில் நிறைய ஸ்ட்ரெச் மார்க்ஸ் வந்துருச்சு, இப்போ இதெல்லாம் நான் ரெடி பண்ணுறதுக்கு ஏதாவது க்ரீம் வாங்கணும், லோஷன் தேய்க்கணும், ஆயில் வாங்கணும். ஸோ மைண்ட் ரொம்ப டிஸ்ட்ராக்ட் ஆகிடுது. என்ன யோசிச்சுன்னா, ஐயோ இன்னே நான் பார்த்துக்க முடியலையே, நான் நல்லா இல்லையே அப்படிங்கிற தாட்ஸ்குள்ளே போயிடுறாங்க. ஆனால் கொஞ்சம் நாளைக்கு தான் இது எல்லாமே. ஒரு 6 months இல்லை ஒரு 1 yearக்கு அப்புறம் என்ன ஆகும்னா, இதுதான் என்னுடைய உடம்பு, இப்படி தான் இனிமேல் இருக்க போகுது அப்படிங்கிற ஒரு உண்மை உங்களுக்கு புரிய வரும். நீங்கள் அந்த புது உடம்பை அக்செப்ட் பண்ண ஆரம்பிச்சிருவீங்க. ஆனால் நீங்கள் மைண்டில் வைக்க வேண்டிய விஷயம் என்னென்னா, கொஞ்சம் நாளைக்கு யூ வில் ஃபீல் லிட்டில் பேட் அபவுட் யுவர் செல்ஃப். ஐயோ நான் இப்படி ஆயிட்டேனே அப்படிங்கிற மாதிரி ஒரு self-esteem சொல்லுவாங்க இல்லையா, அது ரொம்ப கம்மி ஆகிடும். பட் இட்ஸ் டெம்பரரி. கொஞ்சம் நாளைக்கு அப்புறம் எல்லாம் சரியாயிடும்.